I've said this before in other videos. I'm a big proponent of mental health services. Speaking to somebody about your problem, because I've said this before. Dialysis is hard. And it got to a point where I realized that I couldn't do it by myself. And what a lot of patients don't realize is that some insurances will cover mental health services. Like for me, for example, I had to call my insurance for something else, and they informed me that my insurance covers 1 hour a week of mental health services, i.e., a therapist. I did not know that, and I'm assuming that a lot of patients might not know that either. You don't necessarily have to pay out of pocket as a dialysis patient for mental health services to speak to somebody. That's if your insurance covers it, because every state, everywhere, every form of insurance is different. I have Medicare partnership. And with the partnership aspect of that, because I'm considered fully disabled, with the partnership aspect of that, they give me 1 hour a week of mental health services. I speak to my therapist, he runs my insurance number, they pay him, so that way I don't have to pay out of pocket for that. Me speaking to a therapist is crucially important, because after everything that's happened, it got so overwhelming that I realized that I just couldn't. I couldn't do this on my own. I tried. I thought that maybe I could, but with having kidney disease, you deal with a lot of people who don't care, and you deal with a lot of periods of time, long extended periods of time where you don't feel well, meaning waiting for a transplant. And these coordinators and these nurses and these technicians, well, they don't care about how you feel. They're just trying to do their job. A lot of them. A lot of them just want to come to work, have some laughs, and go home. Meaning that the onus of all of that emotional weight falls onto you to deal with. And that emotional weight could easily turn into destructive decisions. Because you're frustrated and you're angry and you feel like you don't have any control, so you try to exact control over whatever it is that you can. So then that turns into, well, I have to go to dialysis, but I'm not going to take my pills, or I'm just not going to dialysis today, or I'm just going to drink whatever, I'm just going to eat whatever, because I'm sick of doing it, and blah, 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 blah. That's what happens when your frustration level reaches it starts to climb to its peak. Believe me, I know. I am speaking from personal experience here, where there were several times where I just looked at the bottle of water and I just said, you know what? F it. I'm gonna drink the water. And whatever happens, happens. And when you don't get those feelings out and you don't get those emotions out, it turns into these things that will not benefit you in the long run. So a common misconception about therapy is that you just go with the first therapist that comes along. No, you have to find the right therapist that works for you. In my lifetime, during this, like when I got sick in 2018, I had one therapist. She was great. Then she moved, and she came back, and she wasn't the same person. Then after that, I chose a different therapist who was terrible. She was awful. And that led me to the current therapist that I have now. His name is Lawrence. And he's a fantastic therapist. He's been with me for years. Like maybe 5 or 6 years. He's been with me for a very long time. And I'm very happy with his services, his input. If you are looking into finding a therapist, therapists have to have certain qualities about them. Right? Like, I don't respond to negative reinforcement, which is what the second therapist was really big into. I don't respond well to that. I would like to think that I'm a pretty open-minded guy. So if you just explain to me, if a therapist explains to me their standpoint, I like to believe I could be very receptive to that. But at the same time, you don't want any like glad-handing ass kissers either. That's just gonna condone everything that you do and just agree with all your destructive, terrible behavior. That completely defeats the purpose of seeing a therapist. This is one of the points that I'm always making, is that nobody gave me that information. I stumbled across that information quite by accident, and I just happened to capitalize on it. And this goes back to a bigger issue of patients are not being educated about their rights and about the services that are provided to them and the processes of how things work to get patients to where they want to be. Granted, if they want a transplant or whatever, the information is not volunteered to them. It's like pulling teeth to get anybody to tell you anything, especially when you first start. Well, this video is for all the dialysis patients on dialysis right now, all the kidney disease patients that are on dialysis right now. If you have insurance, either from the state or your job, and you feel like this is overwhelming, and you feel like you're just out there in the middle of the ocean and there's nothing you can do, call your insurance and ask them about mental health services. You would be surprised. Ask them what they provide as far as mental health. You would be surprised what you'll find if you just take the initiative to look. And if you are somebody that, and someone brought this to my attention, if you are somebody that is taking care of someone that is a dialysis patient, like an elderly patient, an elderly person in your family, whatever, it is important that you understand that dialysis is challenging. And it's even challenging for the older and more vulnerable of us, because they don't always necessarily have a voice. They can't always speak for themselves. So they need someone like you, whoever your caregiver is. Like if you're a caregiver, if you're the daughter, if you're the son, if you're whatever, if you're taking care of somebody that you care about on dialysis, it's important that you listen to them. And it's important that you understand that this is not easy. It's not simple by any means. It doesn't matter if you work a full-time job, if you have kids, if you're trying to get to work. It doesn't matter. Make the time. Because whoever it is that's on dialysis, you only have one of them. And when they're gone, that's it. So try to treat them with as much respect and consideration as you possibly can. But more importantly, the most important thing is to be honest with them. Put yourself in their shoes, or try to get as close to those shoes as you possibly can, and try to see it from their perspective. Ask them questions. Express interest in their treatments. How do they feel? And let them feel what they feel. Because as dialysis patients, we already deal with enough.